you have pain and numbness from your lower back down to the leg? Does your X-ray or MRI scan show disc herniation at your lower back? Have you had treatments but your pain is not getting better and you are worried that you may need surgery? If the answer is yes for the above questions, this is the video for you. Hello everyone, my name is Zoe. I'm a physiotherapist from Pain-Free Physiotherapy and Allied Health. Today I'm going to talk about lumbar disc herniation. Disc herniation occurs when the jelly-like center pushes against the tough outer ring due to wear and tear from degeneration or trauma such as a fall. Disc herniation at lumbar spine can put pressure onto the spinal cord and nerve roots nearby, causing symptoms at lower back and leg. Lumbar disc herniation can be caused by many factors. By looking at the chart here, we can see that sitting, especially slouching and holding a weight, puts the greatest pressure onto the spine. This explains why people sitting a lot at work, such as office workers and vehicle drivers, have higher chance of getting lumbar disc herniation. Additionally, jobs that require repetitive lifting, twisting, and bending with lower back are also at risk of getting lumbar disc herniation. Being overweight is another risk factor because it puts more stress on the disc. Common symptoms of lumbar disc herniation include lower back pain, burning sensation, tingling or numbness from body down to the leg, and weakness at a fat leg. Some research shows that as the disc herniation gets better, the symptoms will gradually move from the leg towards the spine. This phenomenon is known as centralization and usually indicates good improvement to the condition. Another common observation for people with lumbar disc herniation is a lift. A lift is when the trunk moves to one side in order to avoid loading the injured disc. This usually happens in standing or sitting and disappears when lying down. We should avoid correcting the lift early on and encourage bed rest for a few days if standing or sitting aggravates pain. Your doctors may perform neurological examinations to assess the muscle strength, reflexes, and sensation. They may also send you for X-ray or MRI scan and associate the findings of lumbar disc herniation to your symptoms. However, research has shown that there is no direct relationship between the scans and the symptoms. Your doctors may then prescribe pain medication or even cortisone injection for pain relief. If the condition is not improved, they will suggest surgeries such as discectomy to take pressure off the nerve roots. We will talk about 3 key points in treating lumbar disc herniation. The first one is lifting. Hands-on treatments such as transverse glide on L5 is often effective in resolving symptoms. Let me show you how we do L5 transverse glide.
Check if there's any asymmetry with the prone straight leg raise. So if you lift the leg up, the left leg, you observe how stable here it is. It appears pretty stable. It's the left leg, and then this leg, okay, and this leg it actually shift, it rotate to the opposite direction actually. Okay, and relax. And that in many patients that can also accompany by pain. All right. So you want to feel for the quality of movement. Okay, if L5 is problem, usually you can feel a changed in end feel, a changed end feel. Okay, yeah. Usually it becomes stiffer, and you want to feel which way is the stiffness. Okay, and then you wanted to experiment by doing a TDT. For example, if I think the stiffness requires a right to left glide, and I apply a right to left glide on the L5 transverse process, so push it across, and then I ask the client to lift the affected side up again, and then I re-examine if that improved the quality and pain. Yeah. Usually, if this technique is effective, the improvement should be quite dramatic.
The second key point is to identify the preferred direction of movement. Does the body like bending forward or backward? If the patient cannot bend forward because of pain, but can easily bend backward, then we can encourage the patient to bend backwards. This usually happens in tall young men as they tend to bend down a lot during daily activities. For this group of patients, we will encourage lumbar extension by exercise and provide posture education such as avoid sitting on soft sofa or lower sitting car. On the other hand, if the patient cannot bend backwards because of pain but can bend forward easily, then we can encourage the patient to bend forwards. This usually happens in short middle-aged women as they tend to arch backwards a lot during daily activities. For this group of patients, we will encourage lumbar flexion by exercise and provide posture education such as sitting back against the backrest of the chair and place a footstool under the feet. We also need to be aware of the third key point. The cause of these slight symptoms may actually be something outside the lower back. In this case, we will need a head-to-toe examination to find out the real cause. In many cases, the real cause can be in the leg or shoulder. We will then apply treatment to the cause instead of just focusing on the lower back. Let me show you a useful technique to treat a common cause, the calf muscle.
So, calf muscle, you should palpate. The first thing is you should palpate the whole muscle. And then decide where the tightness, the main area of tightness is. Okay, the most common areas to be tight is this one here, the tendon, the muscle tendon junction. So that's the muscle, and then as it transition into Achilles tendon, that's usually where the tension is. Okay, and then some people, the tension point may be a little bit more medial. For example, our subject's tension point is more medial. Okay, some people may be more lateral, but usually right in the middle here.
If you have any further questions, do not hesitate. Contact us and speak to our physiotherapist or make an appointment. You can also come to our free back pain and sciatica workshop to watch a live demo on how people with lumbar disc herniation can be improved immediately. Learn more in-depth knowledge about managing the condition and ask our Principal Rick questions. We look forward to seeing you pain-free.